Welcome back to the podcast. Today, we're very lucky to be joined by an amazing client of ours, Dr. Geoffrey Trenkle of the Los Angeles Center for Ear, Nose, Throat, and Allergy. We've been working with Dr. Trenkle and his team for several years. And over the last few weeks, we've had the opportunity to work very closely with him and get an insight into how he and his team are adapting to the current situation. We've found his approach and his outlook on the entire situation to be very inspiring, and we thought that it would be great to have him on the show to share some of that with you, and we hope that you find it helpful. Thank you very much for joining us today, Dr. Trenkle. Welcome to the podcast.
Yeah, thanks for having me. Happy to help.
So, Adam, I know you've been working closely with Dr. Trenkle, and I think you had some particular topics you wanted to cover. Is that right?
Yeah, so I'll jump in. So Dr. Trenkle and I, we've been working together for, I guess, a couple years now. And obviously this unprecedented circumstance with COVID-19, there's one of the first things I wanted to talk to you about is that plenty of other medical practices out there who maybe aren't viewed as essential have kind of just hunkered or kind of done not much. And some have been more aggressive. And I would say you're on the more aggressive side where you really, took the bull by the horns and made a lot of adjustments and really went after marketing certain elements or making pivots and so forth that I think really sets you apart in how kind of you are approaching this whole thing. And I think there's some learnings that a lot of owners of medical practices can have related to that. One of the first things I wanted to ask is like, why was your approach more aggressive rather than just sort of the hunker down side?
I think that there's a couple of reasons why we did things the way we did. The first would definitely be one of fear in a certain sense. You know, we have a pretty large practice with multiple providers, so there's 9 of us total, and then a large staff. We have over 70 staff members in total, either W-2 or 1099. And when all this hit, we knew immediately that we were going to be hit financially, just like the rest of the country was, and it was going to be hard to make payroll, and that the patients would stop coming, etc. And so, when you get into these times of crisis, or when you see these, I guess there's only 2 ways to respond, right? One is to hunker down, like you said, and say, okay, well, let's furlough everyone, and let's stop doing what we're doing, and let's kind of go into a shell, and we'll weather the storm that way, and that's, for some people works. And then for others, like myself, I tried to look at it almost more of as an opportunity to say, well, how can we get better? How can we become a better practice? And how can we maintain all of these employees? Because I don't want to lose them. I don't want to have to stop paying them. I want them all to be able to come to work, especially the healthcare providers that we need more than ever right now in every capacity, not just ENT. I mean, we're just ENT doctors, but we can all play our part in every way possible. So I think, there was a little bit of fear, and fear drives a lot of different things. And then another part of it was seeing an opportunity and saying, how can we capitalize on it? Not financially necessarily, but how can we capitalize on it in a sense that we can grow as a group, as a practice, as people, as a society? I mean, like all of these things kind of come into play. And, that's, I guess, the main reason why we chose to be more aggressive. It was actually very interesting timing, and things always happen for a reason, right? One of the podcasts I listen to very frequently is a doctor named Peter Attia, and he's kind of a longevity doctor, and very recently he's had an author on who's written multiple books on Stoic philosophy. His name's Ryan Holiday, and he just has, his books have had a very big impact on just kind of the way that I've been trying to live my life, and we're very busy as physicians, but then we also run the practice, etc. But then we have our home life, yada yada. And it's been a very interesting time where I've kind of started to really focus more on looking at individual, crises that happen on a day-to-day basis and realizing how nominal they are. And a lot of the Stoics lived through very intense times, Marcus Aurelius being the most famous Stoic philosopher, and he lived in a time where there was, I think it was about a 75-year plague, and he ended up dying of that plague, and it was how he handled himself and his decision-making during those times that is what made him the person that he is. So I had just started really diving into this and then this happens, and it was almost like I was being tested. Like, okay, well, can you practice what you are trying to learn and preach? And that's been, I think a big part of the reason why we've also been very aggressive is that I've tried to take the approach, as well as my wife, who's my chief operating officer, to really say, okay, this is not. There's one of the things that in Stoic philosophy they say all the time is, you cannot change what happens. You can't change the things that happen in your world and in your life, but what you do always have control over is how you respond to them. And this is that time where none of us can change this. This is a part of our life, and it always will be. But how we respond to this event is what's going to define all of us and our character going forward. And so that's more philosophical than it is marketing, but it really applies to all businesses, because any business can fail. And so what people say is, like, in times like this where you have a horrible crisis, a bad business will fail. It will be over, unfortunately. Good business will survive and see it through, and the great businesses will pivot, change, become a new business, a better business, and on the other side of it, be better for it. And that's kind of the philosophy I think a lot of us should be taking, because we can't stop this from happening, and we can't change what's happening to us, but we can all make a difference and change the outcome. And we all, especially in the healthcare industry, it makes a huge difference the way that we as healthcare providers respond to this. So that was ended up being a more philosophic answer, but I think it's kind of funny that I've noticed a lot of philosophy really does end up translating to business, and especially to marketing. Ryan Holiday actually was the chief marketing officer. He did all the main marketing for American Apparel.
Oh, interesting.
Before he started writing books.
That's really interesting to hear your take on that, because actually that's something we've talked plenty, but you've never particularly shared that side of it with me, and I think that's fascinating. I also think it's very true that you're essentially, life is happening around you, and you're finding your cause point of how you can be cause over a circumstance rather than the effect of it, in other words. So along that line, I know some of the actions that we did, and I think you were already pretty well moving into the direction of telehealth and telemedicine. We were already having conversations about this before this thing even hit, of making some adjustments to your site and getting some stuff more set up to really do a stronger push in that direction. This whole thing really accelerated that, and we made some adjustments to your site like overnight, where it was really, with that foot forward promoting virtual consultations, telehealth. Yeah. And I know from talking to you over the last, we talk almost every day right now, but I know that you're spending a lot of time on doing these virtual consultations. So I'd love to hear from you kind of how that's been going for you, since it seems like you're doing a lot of them. Yeah.
Well, first of all, thank you guys for prioritizing it, and I cannot even tell you how we never could have done it without all the web presence that we have, and that you guys have been so integral in getting telehealth going. There's obviously a million moving parts, but a big aspect of it is getting that message out there. So thank you.
Sure.
Yeah. So it was it's things happen it's so crazy the way that things work. But my wife was actually the one who had spearheaded a project for telehealth, and she did it maybe 2 months ago. And like everything in life, right? Like when you're busy, there's just no time to get that going. We don't need it. We have as many patients as we could ever handle, and we're just booked out for 2 months. We're this and that, and she was very much pushing it, like, no, we need to get this going, because it will provide a lot of value to our patients, and there are people that we can reach that are farther away and into the like far suburbs, and really into even more underserved areas, because we serve a lot of underserved, but in Los Angeles, like in the where they can get to us very easily. But there's so many areas in Northern California, Central California, et cetera, that don't have good access. So that was kind of her philosophy getting started. And to be honest, me and my partner, we wanted it to happen, but there's just so much barrier to entry, and there's only so much time, and we're always so busy. And then something like this happens, and it just, now all of a sudden nobody's showing up in your doors, and nobody's happening. And so I was just like, wow, well, now we have time to do all the things that we we always wanted to do. And on top of that, they're going to be so helpful in this exact time. And so we just went for it and kind of dove all in. At that point, you just kind of have to start making decisions without having as much time to make them. Every day we're making, 20 to 50 decisions every single day between the few of us, making those decisions. And then you have to have good people to rely on to get it going. But it's been amazing. I mean, it's been very funny. Like, now that we're doing this, I can't imagine life without it, because there's so many patients that we're doing telehealth visits on where I'm like, what on earth was that patient getting on a bus, coming to see us in the rain, coming into our office, waiting for 2 hours sometimes to see me, and then me spending 8 seconds like going over a test result and saying like, yeah, keep doing your nasal sprays. Like there's so many things that we do that don't require a full examination, especially when someone's already had one, or we order a test and then they just need their results read, and we don't have the bandwidth to just make the phone calls because we have so many people, etc. And this is such a great medium. And there now, going forward, we are going to do so much more telehealth because it will provide significant amount of value to the patients as well as to the doctors and the providers, not having to do it. And the hard part is just getting it started. And there are bandwidth issues. Not everyone has good internet. Not everyone has an email address that I'd say 25-30% of our patients, we try to get them to do a telehealth, they don't even have an email. And we're like, wait, how is that possible? But it's true. So there are limitations, but it still slows the traffic. And there's just so much you can do. Even just using all the different platforms. Our EMR happens to use Zoom, and using like a Zoom platform, you can have multiple people in the room at once. So we have an MA sitting there listening. We have the reception who can check them in. So it's like they're going through a normal appointment. They check, the reception said, hello, how are you? And then, the MA takes their intake just like they would in our office. And then they sit there waiting in their underwear while the doctor is seeing other people. And then the doctor comes in, hopefully not in their underwear, but sometimes if we're at home, and we do the visit, and then the MA checks them out, and then the receptionist gives them an appointment. It's like, it's no different except that they can be at home watching Netflix. And
yeah, I think it's incredible. I think that the post-COVID-19 era, with just what this is doing, I think you're right. Like, this is essentially going to be an event that changes this sort of circumstance of pushing everything, even with just the relaxation of some of the rules related to it. We'll see if those become essentially permanent or however that goes. But I think that we're looking at a very different post-COVID-19 pandemic era when it comes to telehealth, just in general.
Yeah, I absolutely agree. And, I think that for a long time, this is going to change the way everybody feels about interaction in general. And we'll obviously forget about it after a little while, and we'll all go back to our normal lives. But I think that anyone who is living through this right now, especially, in a large age range, outside of kids and the elderly, I really do think, this is going to make a big difference and change. And if they have access to do things this way, they'll wonder, especially if they've had any visits like with us, they'll wonder, well, why can't I do that next time?
Right. Yeah, I agree. So the other thing I wanted to talk about is that after we kind of made some of those pivots, I know last week, we did a Reddit AMA. So we've done a couple of AMAs together where I think originally I brought the concept of doing an AMA to you. And I don't know if at that time, I can't remember, you have to remind me if you were familiar with the Reddit platform at that time or not.
No.
But since that time, you've done 2 very successful AMAs. And I think that last week, the opportunity to capture... I guess first I'd like to talk about the Reddit platform. So for anyone who doesn't know that's listening to this, Reddit, who's never even heard of Reddit, Reddit is a platform which is essentially a social media platform. It looks very rudimentary, but the reality is 90% of what ends up percolating up onto Facebook and Instagram and things like that, they come from... It's okay. They come from Reddit. Reddit is kind of like they call it the front page of the internet, and it's kind of where a lot of things start before it even makes it more mainstream. It originally was kind of a platform not a lot of people understood because it's not very visual. It's a lot of written communication. But it is nonetheless, there's millions of people on Reddit, and there's a lot of very educated people on Reddit. There's also a lot of trolls on Reddit, but it's a place that if you really want to get out and reach people and position yourself as a thought leader. We recommend to everyone that they learn how to Reddit, so to speak, and that they get out there and they get on the platform. So with that said, we brought up to Dr. Trenkle some months ago the idea of doing a Reddit AMA, and he did a first one, I think 6 or so months ago, something like that.
Yeah.
And it was a very successful AMA. And so I think it generated something on the order of around 30 to 50,000 visitors to your website in a matter of a couple of days. And the one thing I will say also is that what an AMA is it's Ask Me Anything. So essentially there's a subreddit which is called the Ask Me Anything subreddit. It has millions of people that visit it. President Obama has done Reddit AMAs. Like, you have a chance to just ask a person a question in writing, and they have a chance to respond. And it basically goes as long as you want it to go. So to Dr. Trenkle's credit, he was very dedicated to it, and he persisted on answering questions for a very long time, but it generated a huge amount of interest, and I think even some public relations, and you had people from, I think, across the country bringing up some things to you about it that they had seen it.
Yeah.
So I'd love to hear from you, kind of like, what was your experience in working with us and doing the Reddit AMAs, and what kind of value do you think that's brought in getting the word out and answering certain questions?
Yeah. So, I'll answer a few fold. No, to answer your first question, I had no idea what Reddit was. I had never logged in or seen it. I had never even actually heard of it. And so before we did the AMA and you told me it was a good idea, I was like, oh, well, I'll check it out. And I signed on, and I quickly saw how much value there is in Reddit for almost anyone. But it's, at the end of the day, at least when I look at things like marketing, especially as a healthcare provider, marketing, we get 90+% of our patients from referral. Marketing is not the bulk of where our people come, but we have a specific brand that we want to portray to the community. We want to show people what our mission statement is, and we want to provide value as best we can. Not just, okay, we're here to clean your wax or whatever, but that we actually do provide our patients with significant value above and beyond the general practices of ENT. And so that is kind of like the way that I approach marketing is, how can I produce value? And I'm going to assume that if I'm producing value, that people are going to come see me. And so I think all of our content reflects that. I think that if we're showing that we're not doing this because we need more patients, we need to make more money, I'm pouring this dollar out so I can get this patient in, but we're saying our marketing is about brand recognition, it's about you, the patient, knowing who we are before you come to see us. That is so important. Now, the way Reddit, I think, is so interesting is that, to what you said, Adam, you can provide endless value on Reddit, because these are just people that have concerns, and there's a million subreddits. Everything has a subreddit, Tonsil stones has a subreddit. It's crazy. But these people ask questions. They put it out there, and the people that are largely answering them have no idea what they're talking about. And not because they're uneducated, but because they're not physicians. So a lot of times their answers are absolutely correct. And I love going into a subreddit and seeing someone has answered a question that's not a doctor. And they say, well, this is what I read about and heard, or my ENT told me. And I can just give that a quick upvote and respond to it and say, everything that this person said is great. And I put the source that I'm a doctor, blah, blah, blah. Or I answer the questions myself. And so I make it a habit of answering questions maybe once a week or something. Whenever I see one pop up on a notification on my iPad at night, I'll try and answer it. Just because, I guess I like helping people, or that's why I did this. I like providing value to anyone. And it's a great way to do so. And where I've found the most value of the Reddit AMA for myself personally, not including all the website clicks, which was a great positive, which we can go into from a marketing perspective in a second. But, Reddit actually taught me more about what my patients are actually thinking than anything has ever done for me before. Because you think you know what your patients, you think because they come in and they ask you questions, right? But there's a million questions that they have that they're afraid to ask you. That dark negativity on the internet where, for instance, I know you guys have a lot of people that do plastic surgery. Patients probably come in for consult, and there's risks and benefits of a facelift and a breast augmentation or whatever. And they ask you certain questions and you answer all their concerns, but they go home, I promise you, and they're like, but what if this happens? And you don't really know that because they don't ask you that. They don't ask the doctor that. I learned so much in our first AMA about what my patients are actually thinking when they go home. Now, when I do those same consults, I address those issues before they ever ask them. I say, a sinus surgery, for instance, or a turbinate reduction, you don't have to worry about empty nose syndrome because this is what I do to make sure that doesn't happen to you. I didn't know that everyone cared so much about empty nose syndrome, but it turns out the whole world that you're asking to do a surgery on is really scared to get empty nose syndrome. And Reddit told me that. No patient told me that. No other doctor told me that. You can't read that in a book. But I answered, I don't know how many, we had 7,000 comments on that AMA, so I probably answered 1,000 questions. So I answered 1,000 people's questions. That's a pretty good sample size for just nasal congestion and trouble breathing. And I'd say 40% of them were about empty nose syndrome. That blew my mind.
Wow.
And that was the case for everything. There was another weird one. I got hundreds of questions about when I lay down on my left side at night, I can't breathe out of that side. But if I turn over on my right side, and that's not something people bring up with you in the consult, but that's something they really care about. So now I address those forward thinking, and I feel like I learned so much. And the last AMA we did was for COVID-19, and one of my other associates, Dr. Abdu, did it with me because I knew that he was going to absolutely love it. And we don't have that much in ENT that we're doing for this, but I knew that there's a huge need for people out there because they're all scared. Everyone's scared. They're sitting at home, they're isolated, and they're fearful. So when we did that AMA, I think we answered about 1,000 questions again, and all of it was just providing some value to them and, a free consultation, so to speak. But I learned so much about what people are thinking. So now that I'm doing these consultations via telehealth, because we're starting a testing center so that we can help increase the denominator of how many tests are being done, and also to provide more consultation for patients that just need it. I mean, I know what they're thinking. Reddit helped me understand that before I started doing it. Now I've done maybe 30 or 40 of these consults, and each one I kind of know how to answer these patients because I know the tone that's being set before the tone is set. And that's where I think Reddit provides so much value to all of us. Just do one AMA, and even if it's not successful, even if you answer 40 questions and you get 10 clicks to your website, who cares? What you're going to do, what you're going to learn from the AMA is going to be very invaluable to yourself and your own medical practice.
Yeah, that's really interesting to hear, especially how it's kind of related over to how you've taken learnings from it and it's helped you as even a physician with new patients. On that note, you just mentioned the last one that we just did was last week, and it was related to, so we helped you guys create a coronavirus testing website. And like you mentioned, there is for whatever reason, various reasons, I guess, a shortage of currently, maybe this will be resolved soon, but testing that's happening on it, or even just consulting with people who are concerned about it. And you guys have made a pivot to start offering that to people right now, at least for the time being. I don't really know if there's too much for us to cover on that in relation, just other than the fact that we helped you spin up that site quickly, and we're working to drive people who are interested, in getting anything in that area addressed. But, I'd love to hear kind of your take on why you guys went with that.
So, I think that can be broken down into kind of three parts, so number one, when this all happened, we knew we were going to lose a bandwidth of patients, which meant we were going to have providers sitting around essentially doing nothing. Our providers are used to seeing at least 30 plus patients in a day, and we knew we were dropping down to 10 if we were lucky. So if we want to pay these people, we kind of want everyone to have something to do. So we looked at it from the perspective of, one, how can we fill our schedules as best we can? Number two, how can we do that and still provide value, because we don't want to just, call all of our patients and get them on the telephone and refill their Flonase, so that we get paid $80. Like none of that makes any sense. So we want to do something where we're actually making a difference. And then third, how can we use this situation to become better as a group, as a practice, as a business? So this was, again, my wife's idea about testing. because it fills all three of those. On the one hand, it provides significant value to the community. We saw a huge gap in testing. We had patients that were calling us that felt they needed testing. We actually have one of our employees, Rachel, who you talk with more than anyone in our practice. She just happened to be going to London right before this breakout happened, and she was in London right when the travel ban hit and barely made it back on the day that they shut down the gates. But she 100% has it. And so we had to quarantine her for 2 weeks. Now she's going on her third because she's still symptomatic. And she went to, one day she called us and she's like, I feel like I have a pneumonia or something's going on. So we sent her to the ER and they didn't test her. And they said, you don't qualify for testing because the management won't change. So they sent her home. So this is a young person with significant symptoms who's otherwise very healthy, who can't go back to work until she's negatively, has a go-ahead, but there's no way for her to get tested. So these are social people who are now confined to their studio apartment for 3 weeks. The psychological toll that takes on a person is pretty significant, let alone the physical and emotional and everything else that goes with it. So when we saw all of that happening, we said, this is bananas. I mean, I'm more qualified than the two of you guys are, for instance, so what is it that we can do to make a difference? We have 7 providers sitting around that can all help with consultations. So we have unlimited bandwidth that other people don't. We already want to get telehealth up and going, so let's use this as another nidus to get better at it, to get more efficient with it, right? And then, lastly and financially for us, it does provide consultations. So now we can keep our doors open easier. We're hoping we won't have to let anyone really go, so it hits all 3 things. And ultimately, that is the best situation you can come up with in a business, is that you're accomplishing multiple goals with one idea or one, whatever you want to call it. And so obviously we were very thankful that you guys were willing to launch that ASAP, because I think you guys wrote that in like 3 hours or something crazy. And it took a lot of time. Obviously I had to write all the content and come up with the throughput. And essentially my wife and I started a whole second business, while we were running another one, because
Right.
That's what this ends up being.
Like in a day or two. So yeah.
Yeah. But at the end of the day, it's providing a significant value. And I can tell you, it's kind of crazy. The consults that I've done so far, I was telling one of my PAs this the other day, and I was telling my wife as well, these are almost the most rewarding consults I've ever done, because I deal with people breathing through their nose, which, it helps a lot of people. But I mean, I'm not necessarily saving lives every day as a physician. And this is like people with significant psychological, not damage isn't the right word, but people are just really scared. And at the end of every consult I've done so far, every single one, I've gotten a thank you. I never get a thank you. Nobody ever thanks me for looking in their nose, But
Right.
It's like, thank you so much for doing this. I really appreciate you providing the value. And these are people that I told you don't qualify for testing, because 90% of them don't. But they're just happy that they're sitting in their apartment by themselves or with whoever and worried that they're going to get, sick or they're going to infect someone else. So it's been absolutely invaluable already, and we've been doing it for like a week,
That's great.
Yeah.
Well, on that note, it's one of the things I wanted to discuss. I mean, obviously the purpose of this podcast is we want to help anyone who owns a medical practice to learn things and to help do things to improve their practice, whether that's through marketing or just generally to take effective measures in order to figure out how to expand and make yourself have a practice that's next level in the community that it's in. This isn't, obviously we're also Influx Marketing. We're our own marketing company and we are your marketing company. But I wanted to just talk really fast about, generally speaking, I think it's really important for any practice to have a very effective medical marketing company, whether that's us or someone else. There's plenty of other very good marketing companies out there. And I think having a partner that is nimble and fast and has certain service quality elements, I think is essential to achieve, like we talked. You're aggressive. Mm-hmm. You want to get out there. You want to get things done. And I think that it goes without saying that having an ineffective marketing partner, or none at all for that matter, there's some medical practices that think, that's not for me, or some that are kind of, there's still surprisingly some that haven't even evolved into kind of the internet era, believe it or not, and they're not really embracing that. So I kind of, as a business owner, I'd love to hear from you, like, not necessarily even just in relation to influx marketing, but what are your thoughts in regards to the importance of having a really effective marketing partner, and why is that important to anyone who owns a medical practice?
Yeah. So you guys are, I think, our third or our fourth website company, and marketing, etc. And when I first started, it wasn't really an SEO company. Someone built a $3,000 website or something, and then it's kind of like set it and forget it. And then, I want an update, so I email like 9 different people, and 6 weeks later, they put a blog post up or something. And that, a lot of medical website companies are like that, because they know that most doctors just want a landing page more than anything else. It's not about marketing. It's about like, oh, the world of the internet, I got to deal with the internet now. So just get me a website that has basic information and my phone number on it so they can call it. And that's where we started. And then we moved to other ones that had a little bit more capabilities. And we quickly realized that, like, we're a business. We are not in, we are a medical practice, but this is still a business. And it's really, really important to have a good marketing company for a multitude of reasons. The reason why we started doing this and working with you guys and looking for a more advanced marketing company, because you guys are not cheap. Sorry to say that, here, but you get what you pay for,
true.
right?
Yeah, it's true. Yeah.
I mean,
I will acknowledge that.
I tell my colleagues all the time, and they're like, "Oh my gosh, like, I can't believe you pay." I'm like, why? Like, it's such an essential aspect to your business. I know you get all your patients from referrals, but I can't tell you how many people come see us because of our online reviews, the fact that they had 3 people in network and they live an hour from us, and they got an authorization for some other person. They went to their website, they're like, no, thank you. And then they found us, Those aspects, there's so many small things that you just don't realize are happening behind the scenes. And so part of the reason we did this was we wanted to build a brand. We wanted to build a big brand, and we wanted it to be something where, just like when I search for a restaurant, if they don't have specific aspects on their website, I'm probably not going to go eat there if I don't know anything about it or I didn't get a referral. We wanted ours to be the same. We want people to come to our website and always feel like, wow, we trust these people more than we trust, the other people. So that was obviously a really important part. We take a lot of managed care, which is a challenging thing to take, and we actually serve probably more underserved people than any other ENT practice outside of, let's say, the university settings. And that is our bread and butter. That's 90% of our patients, maybe 85 or so. But to me, as a business, one really important thing to survival is insulation. So, if you have 4 contracts and one of them leaves and you lose a quarter of your business or more, that's really detrimental for your practice. Just like any, if I sold sweatshirts and I only had 3 suppliers or whatever, and one of them goes, like, my business is going to suffer dramatically. So when I looked at our current situation, I was like, we are safe right now. We have all these referrals. They are all these underserved people. We have a market on this, but why on earth would I not want a market share in the other side of town, on like people that are finding me on the website, etc.? Because in the case that a global pandemic shows up randomly, you kind of have to be ready for that. You have to be ready for almost anything. And without you guys, we would not have been ready. We'd have almost no patients, because our patients take the bus. Our patients take other means of don't have means of transportation. Our patients are older, and etc. And because we've been so aggressively marketing for the last year, this was a smooth and easy transition for us. I have a friend who has never built a website or whatever, because he's like one of the busiest surgeons I've ever met. But when this hits, all of a sudden, we're not so busy anymore, and you're behind the 8 ball. And so, in my opinion, I try to stay always ahead. You look at the status quo and you say, what's going on? What can I be doing to change? How can I be doing things better? And so I think every physician, within every physician really should have a marketing team and should really have an entire website, everything built, just because you have to be prepared for all of these things to happen. Now, some people aren't going to need that, really small practices, etc., just because, they can shut down. It's not that hard to shut down if you have 5 employees, and then start right back up when all of this happens. But if you have if you're any bit larger than that, and you kind of need to be insulated from bad things happening, whether they're pandemics or just government, like what Medicaid is no longer available, or we are going to cut the Medicare budget by 20% next year because you don't have X, Y, and Z. Like, you're ready to take a 20% hit in your payments, you have to be kind of ready for that. And that's where I think marketing comes into play. And even if you're spending more than you want to be, you just have to look at the return on investment and the what ifs.
Yeah, I appreciate the way that you look at that. And I think that, again, that has to do with your mindset of just being ahead of the game on things like this. And
if I could also flip that back to one quick thing I would want to say is that, yes, it's important to have an effective marketing partner. On the reverse end, for us, the best results come from those clients who we partner with who themselves are also effective marketers. I think sometimes people look at marketing as, I'm just going to outsource this.
Yeah.
And yeah, there are certain things that's our expertise and we'll manage. But the more we can work together, the more the person is, the client themselves, the business owner, the doctor, is marketing minded. There's synergies there where we get a lot more than the sum of its parts. And I would say that's true. That's definitely been our experience working with you and your team in terms of your speed of adopting new technologies. We get varied results or varied responses when we try to help implement certain technologies. It can be sometimes a little slower, the simplest thing, as whether it integrates in with the current software you're using or whatever it might be, it takes some push. And you guys have always been on the forefront of that, very proactive, and that, I think, and very, high touch with us, which is honestly crucial. So I think there's also something to be said about that. Being willing to take the time to do something like a Reddit AMA. This is something that we will do with some of our clients. So when we think there's a right angle for an AMA. But we've had times when that is really hard to carve out the time. In other words, I know the commitment it requires from someone like yourself to steal away from patients for a minute. Notwithstanding these times when maybe your schedule's a little lighter.
Yeah.
At least as far as patients go. But it takes a commitment to really steal away and to take the time to do those things. But you see that return, and so you work with us. And I just can't, I really can't express how important that is and how much that helps us to deliver great results.
I mean, I think for most physicians, the hard part is that, most physicians are pretty busy, or they're generally as busy as they want to be for the most part. A lot of plastic surgeons notwithstanding, because they're usually trying to fight for market share. And that's probably the one, aesthetics is probably the one area where you do have more easier partners, because they understand the value of the marketing, because they're getting most of their referrals through it when they're starting off. And I think the hard part is that, to what you guys are saying, is that there's no secret to marketing, really. It's content, it's value, it's providing your consumers with something really for free and building a trust with them in some capacity. You can't cheat that. You can't cheat good results. You can't cheat. There's no little backdoor into Google that makes people come click on what you want. You can pay for ads all you want, but you're not going to convert unless you have good content. And so content requires time, and that is the barrier to entry for all of us, which is another reason why this global pandemic has given us, I'm like, well, I got time now. I mean, I'm actually seeing I'm working really hard, but I'm seeing my kids more than I ever see them, because I can't do surgery. So normally I'm in surgery 20 hours a week, and that's gone. So what do I do with my time? I'm hanging out with my family and trying to enjoy that. And when I'm not, I'm doing all the things that I never had time to do. And that's why I'm on a podcast. I don't normally have time to be on a podcast.
Creating content.
Creating content. And that's where I think the message to most physicians has to be, is that there's no secret to this. You're a wealth of knowledge, and you specifically, I'm speaking to all your doctors, you think you're special, all right? You're not, but you think you're special, okay? Show people why you're special. That's it. That's the bottom line. Go on Reddit and show them why you're special. Why do you know more than them? Provide the value that you don't think your counterparts can provide. That's what's going to set you apart, always. And having a good marketing team like you guys that are introducing new things like Reddit, or when I say something to Adam, he's always like, yeah, let's do that, or great idea, or not as good an idea. But at least you're always open and helping us to find the best venue. Okay, what can we do to provide more value to people? And if you provide more value, I've always felt if we provide a good business model and we provide a good practice, then the patients will come in. It's not it's not the other way around, you know.
Yeah,
And that's where I think it helps so much.
I appreciate your perspective on that for sure. Well, so one other thing I wanted to cover before we end it off here is, I know recently, I guess it was last Friday, just last Friday, that the stimulus was approved in the U.S. And I think there's a lot of I know that you have your finger on the pulse of that and understand it. And I think that there's a lot of medical practices across the country that should make sure they understand it, that make sure they duplicate kind of what it means. And I'm not asking you to translate. I know you're not an accountant and so forth, but I know that you are familiar with it, and I think it would be interesting to kind of hear your perspective on utilizing the stimulus for medical practices.
Yeah, absolutely. I mean, so I'm lucky enough to also have multiple friends in financial industries and another friend who runs an incredibly successful securities company, you know, and I have been picking their brains since the very beginning of all of this. And what I can say is, you know, taking this stimulus package aside, there's not a single person who knows finance that doesn't say, collect every dollar you can possibly get your hands on and have your capital waiting. If it costs you $10,000 to hold capital for 12 months, get it. I don't care what it takes. Lower as much cost as you can, maintain your business, but like hold on to cash because you're gonna need it to weather the storm. So from the very start, I have been looking into every possible loan that you can get in order to ensure that we can maintain our employees, make sure that we can maintain their benefits, make sure that we can hold on to as many as we possibly can, if not all of them, do everything we can to keep, you know, our business afloat. When this stimulus package came out, I think like everyone else, it was like, I don't think this is really there's no way the government's gonna give us money, right? Like for free or at a discount, there's just no way that's gonna happen. But more and more and more every day, every time I read, it's there, it exists. And, you know, as medical providers, you know, we should all be open. We should be open for business in some capacity, whether it's telehealth, whether it's in the office to see the patients that don't need to go to the emergency room. I don't care what your specialty is. I don't care if you're a plastic surgeon. Make yourself available to people to consult so that those people aren't going to the ER. There's the only one way we're going to flatten the curve, and that's if we are able to provide those things, because the more people that go in the ER, the more people are going to have bad outcomes. We're going to lose all our ventilators, all our beds, etc. So we all have to be able to provide that value, but we can't do that if we don't have any money coming in because there's no patients to be seen. And like in our specific situation, some of our insurances aren't paying us because they don't have employees going to work to process claims. So our income is down a significant amount. So how are we supposed to pay our employees without it? So this stimulus package is designed for just that. And it's really designed for people like physicians because that's who they really want. We're the businesses that they want to keep open. And the PPP loan, which is what just came out, the payroll protection program under the CARES Act, is incredibly beneficial for us. I mean, if you look at it, the nuts and bolts of it are essentially that any employee under $100,000 qualifies under this act, and your payroll, they will give you a lump sum of 2.5 months worth of your payroll. And as long as by June 30th you've shown a loss, which all of us are going to show a loss, there's no way that we're going to make money during this time. As long as you show a loss, the entire payroll is forgiven 100%, including interest on your mortgages, including your rent, so you can keep paying your rent, because that's another big issue. If we don't pay our rent, then those companies are going to go under. If you don't pay your marketing companies, etc., you have to be able to keep paying your bills in order for the economy to not crash. So that's the point of this bill, is to get money into all of our hands and use it for the right purposes. They're going to audit it. If you use it, to make 30% in the stock market while it's down, you're not going to get your money back, But even if you don't get your money back, it's a 6 to 12 month deferral at 4% cap. I mean, that is, and with no fee up front. A normal SBA 7A loan costs $3,000 to $6,000 to process it, to guarantee it, and then you pay interest starting in month one. So even if you got an SBA 7A loan today, by the time you were ready to pay it back, let's say if you were holding that capital for a rainy day, you'd probably lose $10,000, $15,000, which is not the end of the world if you're getting a couple $100,000 to make sure that you have money to pay your people. But in this instance, even if you don't get the money back, you won't have to make payments on it for 12 months. So if you just sit on the cash and just let it sit there and don't use it, you still can just dump it all back, pay it all back, and you're not going to lose anything for trying, And they're going to run out. They're going to run out like in the blink of an eye. So, I would definitely advise all the physicians to apply for it the second it's out. Only banks can do it, not lending companies. They use banks and they'll charge you a fee. So go to your bank, the bank that you use, and start begging for the forms and whatever you're going to need, because you want to get it as fast as you can and deal with everything else in the fallout later, and keep your doors open and try to promote telehealth and try to get people to actually still come in and do things, because then you can feel comfortable, you can pay your employees, so you can have all of this stuff up and running, which is probably the fear for a lot of people, is they're not willing to take the risk to get the telehealth because they got to furlough all their employees because they can't pay them because they're not going to make an income.
Right.
So be, optimistic that this is going to go through, that you're going to get your stimulus package. And even if you don't, the terms of it should be so good that you can just pay it all back. If you want to furlough your employees, you don't trust them to not forgive it, and you don't want to take the loan, at least go for it and apply, because then you can keep your doors open and you can adapt to telehealth, and you can, right now it's so loose. I mean, there are patients that we just make a phone call and I talk to them for 5-10 minutes, and we're billing your normal office visit with the 95 modifier and a place of service O2, because that's what, generally speaking, everyone wants. And we're assuming they're going to pay us normal prices because that's what they've said. Who really knows? But at the same time, it's worth it to try, because it's better than doing absolutely nothing, which is what a lot of people are doing.
As always, Dr. Trenkle, I really appreciate your time, and I appreciate just your perspective on things. It's a unique perspective, and I think it's refreshing. I think it's admirable. I think that you really, really go after your area and you take your whole business very seriously, and I appreciate that. So
thank you.
I don't know.
Particularly interesting to hear your philosophy behind it, as you kind of shared in the beginning. I'll share with you that my full name is actually Maxim Aurelius. You mentioned Marcus Aurelius. My father gave me that name, and I think it's very interesting, your outlook on it, because I think there's a lot of different responses and reactions to this. Some people are reacting or responding with fear. Some people might frown upon. In your case, I mean, I think you've done everything responsibly and right, and you've adapted to bring services badly needed in our city and all over the world in terms of testing and at least screening patients. But I really don't think there's anything that anyone could frown upon. But there's all kinds of reactions to this, and I think your outlook, it applies to any industry, any specialty. That really, this is a time when we test ourselves, when we look at how we respond, and when everything is stripped away and it's just down to you and your team and your people and your resources that you might still have left. Very encouraging and inspiring to see how you've responded. And I look forward to seeing how you continue to evolve. You mentioned there's changes already. In an earlier conversation you mentioned, and on the podcast here, that you can kind of foresee in the practice. So I'll look forward to seeing how you continue to evolve and how we all evolve as a result of this, both in our personal lives and our professional lives. So we should have you on again to kind of talk about it another time.
Yeah, be happy to. I'll recommend for anyone that's interested in, what you were talking about and in all of this kind of Stoic philosophy, the author's name is Ryan Holiday, and he wrote a book a few years ago called The Obstacle is the Way. And what it's about is, most people see an obstacle and you're confronted by it, and it either puts you back, or you try and go around, or you give up because, something in my way. Like, I'm done here. I don't want to do that because it's too hard, and, the government's not going to pay me for that or whatever. So I'm done here. And what he preaches and what the Stoics preach is that the obstacle is what defines you. It's actually the moment when you confront an obstacle, how you respond to that is the important part. And that's what makes certain people able to be great. Nobody's inherently born with any very specific quality necessarily. It's about perspective, and it's about understanding that type of thing. And so that's kind of the way we try to approach everything. And I would recommend any business owner, which is pretty much all medical practices, read a book like that, because it's very easy. He does a good job of making it very easy to read, but the message is very clear and succinct to tell you how to change your own habits, how to get out of, the paradigms that kind of hold us, especially in medicine. We're so confined by specific paradigms, and being able to break out of those, and that breaking out of those is what does inspire change. It's how we advance as a specialty, it's how we advance as a community, and being able to look at the things that are currently in place and say, like, why is that in place, and how can I break it down, and how can I make it better? How can I make it more efficient, more effective, and reach more people? How can I work within these confines to advance, my field? That's the really important message that we all need to be taking out of all of this, is that, you don't know what's going to happen, and you have to be ready to respond to it in the most, effective way possible.
I couldn't agree more, and I really appreciate you sharing that philosophy and your outlook. I think we all need more of that. We all need to look towards things that can empower us in this time, and that can help us to feel like we can find a path forward within ourselves. So thank you very much for that. Thank you very much for your time today. We'll let you get on with your day, spending time with your family. And thank you everyone for joining us. Join us next time on Next Level Practices. Take care now.